Hello there, it's Dr. Ominde again. In this series, we are going to discuss the anatomy of the foot, basically. So the osteology, the arcs of the foot, and the muscles of the foot. So what forms the foot? We have bones, and these bones include the tarsals, the metatarsals, and the phalanges. So the human foot is complex, usually with 26 bones and 33 joints and more than 100 tendons, muscles, and ligaments in total. So the proximal region of the foot is formed by 7 tarsal bones, and the talus is the bone at the ankle, so it's called an ankle bone. The calcaneus is the heel bone, and the navicula is called navicula because it's like a little boat. Then we also have 3 cuneiform, which are wedge-shaped, so lateral, intermediate, and medial. And we also have a cube-shaped tarsal bone, which is the cuboid. So those are the 7 tarsal bones. So as you can see, that's the calcaneus, the talus, anterior to each you have the navicula, and the 3 cuneiform, medial, intermediate, and lateral. And then from the calcaneus on this side, you have your cuboid, and on X-ray, that's your calcaneus articulating with the cuboid anteriorly, or rather distally. Then on the superior aspect, it articulates with the talus. The talus articulates with the navicula with the 3 cuneiform. So the talus is the only bone that articulates with the fibula and tibia, and together they form the ankle joint, the talocrural joint. And this is formed by the superior surface of talus and the medial and lateral malleoli. So during walking, the talus helps to distribute the weight from the tibia to the calcaneus and to the rest of the other tarsal bones. So the talus, again, has no muscle attachment and usually has a unique blood supply. Remember, like the blood supply of the scaphoid in the upper limb, the talus also has a unique blood supply. So this is your talus here. It rests or rather sits onto the calcaneus. That's your talus within the lateral and medial malleoli and the inferior surface of the tibia, which form the mortise of the ankle joint. So that's the talus. It has no muscle attachments, but you have ligaments that will attach onto it. Then we have the metatarsals. We have 5 of them. From medial to lateral, they're numbered number 1 to 5, and each of them has a base, a shaft, and a distal portion. So the distal portion is the head, the shaft is the intermediate portion, and the proximal portion is the base. So the metatarsals usually articulate with the first, second, and third cuneiforms proximally, and with the cuboid to form the tarsal-metatarsal joints. The metatarsals articulate distally with the phalanges to form the metatarsal-phalangeal joints. So this is what we are discussing. Okay, so you can see with the cuneiform, the first to third, and with the cuboid, you have the fourth and fifth metatarsals. Then distally, metatarsals are articulating with the phalanges. So these are first to third with the first to third cuneiform, and then last 2 with the cuboid, and distally they all articulate to form the metatarsophalangeal joints at this portion. Then the phalanges are numbered, the digits are numbered 1 to 5 from medial to lateral, and each digit has 3 phalanges, except the first digit, which has 2 phalanges. The first digit, the big toe, is called the hallux. It has 2 phalanges, the proximal and distal, but the rest have 3, and each phalanx has a base on the proximal aspect, a shaft, and the distal portion is the head. So all the toes have 3 phalanges except the hallux, and between the phalanges you have the interphalangeal joints. So hallux has 2 with the interphalangeal joints. Remember, we have some sesamoid bones at the first metacarpophalangeal joint. Then the rest have 3 phalanges. So what's the function of sesamoid bones? We say these are at the metatarsophalangeal joint of the great toe, and they protect the tendon that flexes the toe, and this includes flexor hallucis longus, so they protect it from the body weight. So at the upper forepart of the medial surface of the calcaneus, there's a horizontal eminence of the calcaneus. You can see that's the sustentaculum tali. This gives attachment for the tibialis posterior muscle, which is a muscle in the deep portion of the posterior compartment, so sustentaculum tali. So we have arcs of the foot, and these arcs are held by tendons and ligaments, and they usually allow the foot to support the weight of the body. So the weight of the body will now rest, 60% will be on the heel, and another 40% of the weight will be on the ball of the foot. So the arc of the foot also acts as leverage for walking, and they're usually fully developed by the age of 13. So support of weight to concentrate mainly on the heel, 60% and 40% on the ball, and they act as leverage for walking. So the longitudinal arc is usually higher on the medial side, and it's made up of the first 3 digits. So these first 3 digits form the longitudinal arc. So the digits plus the 3 cuneiform, the navicular bone, and the talus, they form the longitudinal arc on the medial aspect. But we also have the lateral longitudinal arc that is made up of digit 4 and 5, okay, with the metatarsals 4 and 5, plus the cuboid and the calcaneum. So those are the 2 longitudinal arcs. The medial by the 3 digits, 3 medial metatarsals, 3 cuneiform, navicular, and cuboid, and the lateral arc, longitudinal arc by the 2 digit 4, 5, with the metatarsal 4, 5, the cuboid, and the cuboid and the calcanea. This one is digit 1 to 3 with the metatarsals, 3 cuneiforms, navicular, and the talus. But we also have the transverse arc of the foot, and it's mainly formed by the 5 metatarsals, which form the transverse arc of the foot. So because of the higher medial longitudinal arc, that is why a footprint looks like this, because the medial aspect of the foot does not fully touch the surface of the ground. So the medial arc is higher. This is the medial arc, and the lateral arc is formed by the calcaneus, cuboid, and the last 2 metatarsals and digit. So what maintains these arcs of the foot? Number 1, ligaments. So which ligaments? We have the long plantar ligament, then we have plantar calcaneo-cuboid ligament, and the plantar calcaneo-navicular ligament. So when they ask you to discuss the factors that maintain the arcs of the foot, don't just list ligaments, muscles. No. You say ligaments and you mention the ligaments that you're discussing about. So the long plantar ligament, the plantar calcaneo-cuboid between the calcaneus and cuboid, plantar calcaneo-navicular between the calcaneus and the navicular. Then we have muscles. We have both intrinsic and extrinsic muscles, which help to maintain the arcs of the foot. So intrinsic muscles are the small muscles of the foot. Extrinsic muscles are the tendons that are coming from the leg. Which long tendons are these? Tibialis anterior, tibialis posterior, peroneus longus, flexor hallucis longus, and flexor digitorum longus. Those are the main extrinsic muscles that maintain the arcs of the foot. Tibialis anterior and posterior, peroneus longus, flexor hallucis longus, and flexor digitorum longus. Number 4, we have plantar aponeurosis that helps to maintain the medial arc of the foot, the plantar aponeurosis. So all these are the factors that maintain the arcs of the foot. So what are the functions of the arc? They help to properly distribute weight and concentrate it on the ball of the foot and the heel. And there's a spring effect while walking, so that makes walking to be efficient because of that spring effect. And then protection of soft structures. Remember, the foot has neurovascular structures, so to protect them, you lift the foot off the ground. The arcs elevates the foot, so you protect the soft structures. So this is your plantar aponeurosis from the calcaneus, then it spans out, to go and insert onto the distal aspect of the foot. So that's the plantar aponeurosis. So in order for the flexor and extensor tendons to perform properly, they must be kept close to the bones, and that's where the retinacula come in. So we have the extensor retinacula on the extensor aspect of the foot, flexor retinacula around the tarsal tunnel, and extensor retinacula is divided into superior and inferior. So they prevent bowstringing of the tendons and to keep them close to the bones. So these are the extensor, the superior and inferior extensor retinacula, and this is your flexor retinacula, the tarsal tunnel. And laterally you have your peroneal retinacula, inferior and superior on the lateral aspect. So these are the retinacula. This is the tarsal tunnel. You can be asked to name the structures of the tarsal tunnel in order, or name the medial structures, the structures on the medial that form the medial relations of the ankle joint. That means the structures of the tarsal tunnel. So how do you remember? They say you use the acronym Teach Doctors Anatomy very near hospital. So teach doctors anatomy very near hospital. So teach T, tibialis posterior, doctors flexor digitorum longus, anatomy posterior tibial artery, very posterior tibial vein, nerve, very near hospital. So near is nerve, so that's your tibial nerve. Hospital is flexor hallucis longus. So teach doctors anatomy very near hospital. Tibialis posterior, flexor digitorum longus. Okay, then artery, vein, and nerve, tibial, posterior tibial artery and vein, and tibial nerve, and then flexor hallucis longus. So those are the structures from anterior to posterior within the tarsal tunnel, or the medial relations of the ankle joint, the structures in the tarsal tunnel. Then on anterior relations of the ankle joint are the structures on the extensor compartment of the foot. So you have your tibialis anterior, followed by extensor hallucis longus, and extensor digitorum before you get to peroneus tarsus. Tibialis anterior is the most medial, followed by extensor hallucis to the big toe, extensor digitorum to all the other 4 digits, and then peroneus tarsus. Then the lateral, posterolateral aspect of the ankle, you have peroneus longus and peroneus brevis. Remember, peroneus longus and brevis from the lateral compartment of the leg. So then muscles in the foot. So we start with the first layer. Okay, so that will be abductor hallucis. Okay, so the first layer has abductor hallucis, followed by flexor digitorum brevis and abductor digiti minimi. So after you've removed skin and plantar poneurosis, you have abductor hallucis, flexor digitorum brevis, and abductor digiti minimi. Then, when the flexor digitorum brevis is removed, what do you see? The second layer of the muscles of the foot. So you have quadratus plantae. Okay, you have quadratus plantae. You have your lumbricals on the tendons, and the tendons of flexor digitorum longus where lumbricals arise. Okay, so that's what you see when you remove the flexor digitorum brevis. You have the quadratus or the accessory flexor. So this is your quadratus plantae, accessory flexor, quadratus plantae, flexor digitorum longus, going long tendons to the digits with lumbricals originating from the tendon of flexor digitorum longus. So that's the second layer. Then when you remove that, you go to the third layer. What is in the third layer? You have your flexor hallucis brevis. Okay, flexor hallucis brevis. Then you have your adductor hallucis, and adductor hallucis has 2 parts. It has an oblique head. You can see the fibers are oblique, and a transverse head. Then lastly, you have your flexor digiti minimi brevis. So those are the muscles in the third layer. Flexor hallucis brevis, adductor hallucis with an oblique part and transverse part, and lastly, flexor digiti minimi brevis to the little toe. Then lastly, the fourth layer of the foot has the following muscles, the interossi mainly. So you have dorsal interossi, so you say dab, they abduct, and plantar interossi, pad, they adduct, plantar adduct, and the dorsal abduct. So these are the interossi. So on the dorsum aspect, they will abduct, and the ones on the plantar aspect will adduct. Also, we have the tendon of peroneus longus. Remember, it's coming from the lateral compartment of the leg, and it will cross from lateral to medial aspect. So that's peroneus longus muscle. So those are found in the fourth layer of the leg. So just a recap, the first layer, abductor hallucis, flexor digitorum brevis, and abductor digiti minima. The second layer, you have your quadratus plantae or accessory flexor, the flexor digitorum longus tendon, and the lumbricals originating from it. The third layer has flexor hallucis brevis, adductor hallucis which has oblique and transverse fibers, and flexor digiti minimi brevis. And lastly, the fourth layer has the dorsal interossi that abduct, plantar interossi that adduct, and you have peroneus longus from the lateral compartment of the leg passing posterior to lateral malleoli of the fibula, crossing from lateral to medial to go and insert towards the medial aspect of the leg. So that's your peroneus longus.